It's time for Health Matters, and February is Heart Month. The perfect time to learn about your risk of heart disease is right now with Dr. Shah and this beautiful young lady, Tammy here, who is like me and ignored it a lot and was like, Dr. Shah, yeah, we'll see. Yeah, we'll see you later, whatever, like that. But we can't do that, can we? Especially this month is very important. And let's talk about what HonorHealth does first, because it's also a very great place to go for other medical needs too. But again, your area is very important.
Yeah, so I represent HonorHealth Cardiovascular Center of Excellence. Our goal is to keep the community healthier and happier and living longer. This month in particular, as you mentioned, is Heart Awareness Month. And in particular, this Friday is Go Red for Women Recognition Day, where we recognize the importance of focusing on women's cardiovascular health. A lot of people don't know, but cardiovascular disease or heart disease is the #1 killer of women in America right now, with more than 1 in 3 American women who dying from heart disease. That makes it more deadly than all of the other different forms of cancer, including breast cancer combined. And every 90 seconds, unfortunately, 1 American woman right now is suffering a heart attack.
Wow.
So it's a big deal. And unfortunately, women who have heart attacks often don't do as well as men because they're tougher than men, and they sometimes don't go to the hospital or see doctors as much as they should.
Right.
And unfortunately, sometimes with cardiovascular disease, time is of the essence. So you want to get in earlier and get in while the disease is not even there, or prevent the disease or treat it acutely earlier.
Right, and you know, we did have the tragedy just recently with the mother who pretty much collapsed, and both the child and mother died. And it's because they said it's probably her heart. And that's where we bring Tammy in, because Tammy, you're like some women, as he said, are tough. You don't want to go there because you have everything to take care of the family. You got to make sure work is done, everything's there, and you said, I'll put it over here. And then eventually, someone told you, who loved you very much, to get taken care of, right?
Absolutely. I had had some symptoms for almost 10 years and ignored them all because, you know, when symptoms come up, you're right, we're tough. I was maybe just anxious and nervous and stressed about work and taking care of the house, and I travel for work. So yeah, absolutely, I ignored all the symptoms till one day I had the right person with me and said, you need to get to the doctor. And then ultimately, it was a very simple procedure in the sense that I had an angry wire, a wire that was creating an angry heart, as I call it. And I can let Dr. Shah explain what that is. But I wish I would have done it 10 years ago, and I would have been less stressed over the last 10 years.
So let me ask you, were you embarrassed about it? Because I think that sometimes women feel embarrassed that, you know, I feel weak and I'm supposed to be the strong person, right?
Yeah, because you're worried about taking care of everybody else. You downplay it, right? In fact, even the day that my daughter saw what I was doing, she asked me what I was doing because I was trying to do where I was trying to relax myself that day with trying to calm my heart down. And she caught it. And if it hadn't been for her, I never had seen the doctor. Wow,
amazing. Doctor, let's talk about that. What is an angry heart or angry problem there?
So Tammy had a very common issue called the supraventricular tachycardia, or an abnormal heart rhythm, where all of a sudden her heart rate would go to 150 to 250 beats per minute for a short period of time. The problem with that is, 1, it's annoying. You can feel that a lot. 2, sometimes you can get dizzy. And 3, sometimes in the worst situation, you can actually even pass out. So it's a big, big deal. And the reality is, even with a small amount of medication, usually you can treat it, or with the minimally invasive procedure, you can get rid of it for the rest of your life. And so she could have been healthier and happier 10 years earlier if she had come in and avoided any trouble. But we're happy that we got to her now.
I love it. Now, doctor, this is one thing that's very important. I need people to listen to this because it's very easy, some tips here, to take care of it right now before you need to see a doctor, right?
Yeah, absolutely. So I would just emphasize a few things. Number 1, be vigilant of any symptoms. All of us have this notion of this sort of Hollywood heart attack where you're clutching your chest, having chest pain. But for most people, including women, that's not always the case. If you've got exertional fatigue, dizziness, shortness of breath, some of those things could be related to your heart. So seek counsel with your doctor or your heart specialist as soon as you can. Number 2, know your numbers. The World Health Organization and CDC estimate that 50% of all heart disease can be prevented if you just focus on your blood pressure, glucose, cholesterol, waist size. Number 3, make sure you exercise. Every cardiologist, every heart doctor, and every physician would tell you that with 15 to 30 minutes of aerobic exercise, just where you're breaking a light sweat 3 to 5 times per week, you could probably combat all heart disease and you could prevent medications. And then number 4, probably the most important thing, is take care of your whole body. We know that stress increases your risk for heart attack, so you got to sleep more than 5 hours a night. Number 2, you got to get your flu shot. We know that just by getting your flu shot, your risk for heart disease in flu season is dropped by 50%.
I didn't know
and number
that.
3, go to see your dentist even. Just by preventing teeth infection, you could actually decrease inflammation in your body and make sure that you don't get heart attacks. And then the fourth, what we were alluding to before, don't smoke and don't drink, because those things don't do anything good for your heart.
There you go.
It's a big topic. I would just emphasize that there's a lot going on at HonorHealth on February 14th and 15th. We have a lunch for women who are focused on heart disease. We're going to have national speakers and local speakers talk about educating yourself. There's also going to be sort of screening for heart disease that's available there. So if you're interested, please reach out to HonorHealth.com and go there.
I like it. There you go. We'll have the information on, of course, aztv.com.